Kawasaki disease is a medium vessel vasculitis commonly seen in young children of Asian descent. The diagnosis and treatment for Kawasaki disease can be tricky, so in this video I will give you my visual mnemonic so you don't miss a question on test day. It all starts with a father taking his son out for a bike ride in Japan. In case you didn't notice, the motorcycle is a Kawasaki motorcycle, because Kawasaki is famous for their motorbikes, right? Coincidentally, this Kawasaki bike is our symbol for Kawasaki disease. It seems that our father and son are riding through their local park. Just look at that fountain. Every park has a fountain, right? And I would consider this fountain a medium-sized body of water. You know, not as big as an ocean, nor as small as a puddle. This should remind you that Kawasaki disease affects medium-sized vessels. I know, you're dying to know more about the statue on this fountain, right? We'll come back to it. However, let's focus on the little boy for a bit. This boy is Asian, which makes sense given that we're in Japan. Coincidentally, this Asian boy should remind you that Kawasaki disease normally affects Asian boys under the age of 5. However, while it is more common in Asian boys, I want to emphasize that this condition is not exclusive to people with Asian descent nor boys. In fact, it is quite likely that you will see a case of Kawasaki on your rotations in pediatrics, as Kawasaki occurs in children of any ethnic background. The exact cause of Kawasaki disease is not well understood. It is thought that in genetically susceptible patients, infections may trigger the disease. Infection and tissue injury can lead to the formation of autoantibodies targeting self-antigens, particularly those inside blood vessels. These autoantibodies go on to attack blood vessels, thereby precipitating the vasculitis. Kawasaki disease is diagnosed clinically, so let's introduce a few symbols that cover how a patient might present. First, take a look at the boy's cool motorcycle goggles. Yes, these goggles are very red, symbolizing the conjunctival injection seen in Kawasaki disease. Basically, this just describes the red conjunctiva, or increased redness in the whites of your eyes. Now, what is the boy doing with his tongue? Kids will be kids, and this kid is mocking some other park visitors by sticking out his tongue. This tongue should remind you of strawberry tongue, a classic finding in Kawasaki disease describing redness and swelling, also called strawberry tongue, seen in Kawasaki disease. Strawberry tongue is super important to remember as a hallmark sign in Kawasaki disease. And it looks something like this. Such a mischievous child. Now let's go to the dad. That is such a cool biker jacket. So rugged, with that punkish heart. This heart should remind you of the cardiac complications in Kawasaki. If left untreated, Kawasaki disease can lead to the feared complication of coronary artery aneurysm. In fact, cardiac sequelae are seen in about 20% of patients with the disease. Coronary vascular involvement may result in asymptomatic coronary arteritis, progressing to life-threatening coronary artery aneurysms. These aneurysms can then rupture, leading to infraction and potential death. The risk for aneurysms is highest in the 2nd to 3rd weeks after the onset of symptoms. To prevent this complication, it is important to both diagnose and treat Kawasaki disease early in its course. Very scary complications for a childhood illness, if you ask me. Let's look at the father's neck choker now. Don't all motorbikers wear chokers? This choker should help you remember cervical lymphadenopathy. Lymph node involvement around the cervical or neck region is commonly seen in Kawasaki disease. The lymphadenopathy is mainly unilateral, and is the reason Kawasaki disease is also referred to as mucocutaneous lymph node syndrome. You know, muco describing the involvement of the mucous membranes like the mouth and tongue, cutaneous describing the involvement of the skin via rash, and the lymph nodes describing, well, lymph node involvement. Obvious, really. What about the biker dad's gloves and boots? Yep, like any cool biker, he's got bright red gloves and boots. These bright red gloves and boots also remind me of the hand-foot changes seen in Kawasaki disease. Specific changes include redness and swelling of the palms and soles, as well as peeling or desquamating rash seen in the fingertips and toes. Next, the red color of the gloves and boots should also remind you that a desquamating rash is seen in Kawasaki disease. You know, because it looks like the skin is red. The rash in Kawasaki disease is polymorphous and desquamating, affecting the trunk and extremities. As a vasculitis, or inflammatory disease affecting systemic blood vessels, it's not really that surprising that skin findings are seen. Let's move on. Alright, now to the final symptom. Check out those flames coming out of the exhaust pipe of the motorbike. Wow, that's hot. By the way, these hot flames should remind you of fever. A fever lasting 5 days in a child is a cardinal sign of Kawasaki disease. And when seen together with other signs we've just talked about, you should be thinking hard about Kawasaki disease. I think our mnemonic so far is better than anything else out there, but you may encounter another mnemonic, crash and burn, for the symptoms of the disease. The first letters of crash are C for conjunctivitis, R for rash, A for adenopathy, S for strawberry tongue, and H for hand-foot changes, while the burn bit stands for fever. Personally, I find this mnemonic, especially the adenopathy bit, really hard to remember, but I've included it here for those of you who might find it useful. Having covered the presentation of Kawasaki disease, let's move on to treatment, which is very important in order to prevent dangerous cardiac complications of the disease. Let's pivot back to that fountain. Take a closer look at what the statue in the fountain depicts. Yep, it's an elephant fighting a man with a spear. This elephant has big ivory tusks, and this ivory should help you remember IVIG for treatment. You know, ivory for IVIG. IVIG is given in a single high dose and is most effective within 10 days of disease onset to reduce risks of coronary artery aneurysms. Next, take a look at the spear of the man. Wait, a spear? Isn't that Pixarize's recurring symbol for aspirin, or aspirin? Yup, that's right, aspirin is the preferred treatment for children with Kawasaki disease. But wait, isn't giving aspirin to children risky because it can lead to Rey syndrome or the aspirin-related liver failure? Well, you're technically right. Aspirin is usually avoided in kids due to the risk of Rey syndrome. However, Kawasaki disease is an exception to the rule, and exam writers love this. Quite simply, coronary involvement is too common, and due to the extreme mortality associated with coronary aneurysm, it's worth it to give aspirin in spite of the risk of Rey syndrome. Aspirin is just so good for treating this disease that its benefits outweigh the risks. So from now on, if you catch Kawasaki in a clinical vignette, you should consider high-dose oral aspirin and IVIG as treatment. Note that you can also supplement this with IV corticosteroids in high-risk patients, but this is low yield and not really testable. Just remember our spear here to peg aspirin as a treatment for Kawasaki disease on test day. Alright, we're done with our motorcycle tour. Let's quickly sum up what we've learned and ride on home. Kawasaki disease is a medium vessel vasculitis that usually affects children less than 5 years old. Although the classic patient affected is an Asian boy, this disease is not exclusive to people of Asian descent, nor boys specifically. So be sure to consider this diagnosis for any child with the appropriate signs. The cause of Kawasaki disease is an autoimmune reaction that creates antibodies against endothelial cells, or the cells that line our blood vessels. Diagnosis of Kawasaki disease is clinical and symptomatically includes fever lasting 5 days, conjunctivitis, strawberry tongue, lymphadenopathy, rash, and hand-foot changes. Once diagnosed, it is extremely important to immediately treat Kawasaki disease with aspirin and IVIG to prevent cardiac complications like coronary artery aneurysm. And we're finally done. Stay safe on the roads, folks. We'll see you next time.